name is Doreen Burns. Actually, back in 2005 and 2006 and 2007, I happened to have just kind of a normal checkup with my doctor, and he noticed that I had quite a bit of varicose veins, or kind of that very pronounced spidering effect on my legs, and he suggested, as he did further tests, then I actually had a blood clot. So what he did is, I did that vein stripping that they did way back in the day, and I think I recall Dr. Vanderwoody called that as probably kind of a very unnatural type of procedure that would even be contemplated today. But I had that first done in 2006, and I actually had it done again in 2007. And I know that the folks here were just really surprised that the procedure was actually done twice to me back in the day. Fast forward to basically about 2015, 2016, I had a normal annual exam with my regular standard physician, general practitioner, and she also suggested that I have my veins looked at because it looked like everything came back, and I had varicose veins and issues again. I had a lot of pain in my legs. When it got to be bad, the pain level got to be pretty high, and so my career since 1982 has been interior design, and so that's typically a lot of going to their home, going into someone's home, working with them, getting samples in and out of my vehicle, and also doing computer work, sitting at a desk, walking around a store. So by the time the end of the day would get here, starting my day at about anywhere between 6 and 6:30 in the morning, and not ending my day until 6 or 6:30 in the evening, by the end of the day, I could actually almost feel my legs pulsating in pain, that they hurt so bad. So, and that was the very first time I came here to Advanced Medical Imaging.
Hi, my name is Joni Beckman, and I'm a physician assistant at Advanced Medical Imaging. Doreen is one of my favorite patients who's had tremendous success with treatment. She came in with bilateral lower extremity pain, swelling, and visible varicosities. She was treated with endovenous laser ablation to the right great saphenous vein. This was followed by sclerotherapy to varicosities involving both lower extremities, and then ultimately went on to IVUS and stenting of the right common iliac vein. On follow-up, she has noted 99% improvement to her pain, aching, and visible varicosities. She's been very happy.
And that was such a short amount of time out of someone's lifetime to make sure that your legs feel better, and have such actually a very pretty result besides. That was another really wonderful surprise. When I would think about getting dressed for my day, if you were to look at my closet before I had the procedure done, you would see nothing but dress slacks and maybe suits. I would never wear anything and never even think about wearing a dress or a skirt because of how my legs looked. And now I have no problem finding a nice dress or something that would look very nice. I don't feel as though I have to cover my legs up anymore. And sometimes I think that's a psychological thing with ladies. We think that, you know, as part of the natural aging process, we don't think about something as wonderful as this that could change your life and how you feel. You don't have to age that way anymore, that I felt in my legs. So I guess if you're experiencing anything, or even something as cosmetic as you don't feel comfortable wearing a skirt or a dress anymore, you're just wearing slacks or long skirts, I would truly look into Advanced Medical Imaging and just see what they can do for you, because the pain relief and the difference that it's made in my life has just been, I really even find words hard to describe, because it has just made me feel so good. I had no idea that I could look and feel so much better just after the procedures that were accomplished here. I had no idea. It was one of those things where I thought I was just going to have to live with, you know, the cards that I had, what I was dealt with for the rest of my life, and that is not true. They will take excellent care of you here.